gowns, your hair coverings, your shoe coverings, your eyewear, your N95 mask, as well as our facility has gone above and beyond to ensure the safety of our staff by using, should we have a patient of interest that we have to isolate, that we are going to be using full hazmat suits with PAPRs. Because if we have a patient, of course, this disease progresses very quickly, so it's going to be harder to contain those blood and body fluids. So what that means is the need for that full body suit, that hazmat suit, would need to come into effect as the disease progresses. In the early stages, you can kind of contain those blood and body fluids because the transmission of this is blood and body fluid. So that means you would have to have some type of contact in your mucous membranes, which would be your eyes, your nose, your mouth, in contact with someone with that virus or that infection, or some type of break-in skin or needle stick. So you can transmit this, but of course, you know, this is not an airborne disease. A lot of community and staff are wondering why the N95 mask, why the airborne precautions. It's because when you're treating a patient with multi-organ failure and sepsis and they're going to require some type of respiratory treatment, that is when the danger becomes where this disease or this virus can actually become airborne. So you practice airborne now because you don't want to alter that PPE and have that break in chain where we're not exactly sure what we're supposed to have on. So of course the strain is mutating all the time. Just to ensure that, so you're going to practice your airborne and your contact precaution.
Okay.
Pretty comprehensive.
Yeah, she knows her stuff, doesn't she?
You've gotten up to speed on Ebola. Not that you didn't know about it, but I guess.
And it's important for them to understand, you know, that this is not a new disease. This has been around since 1976 or longer in West Africa. The reason it has been such a terrible outbreak over there is because normally outbreaks of any kind start in a small village or community and kind of branches out. This one actually started in 3 separate areas of West Africa. And in West Africa, they don't have the sanitary means that we have here in the United States. They don't have good sanitation means, they don't have good PPE, which, you know, they do practice certain rituals and beliefs to where they actually cleanse the body from the inside out in preparation for funeral and burial, those kind of things. So when you think about these people manually removing undigested food and feces and they don't have the good sanitation means, then of course that becomes problematic in spreading any kind of virus or any kind of disease, but especially Ebola. So they are having a hard time of containing this virus over there. But here in the United States, we have the proper equipment, we have the protection that we need. It's just really educating staff, educating community of people of the transmission, how they can protect themselves, and the steps that they need to take.
You know, one thing that, given the coverage on WIS last night, you know, we had some patients ask one of our physicians today, is it safe to come into our facility? And he responded correctly by informing the patient that they should be thankful that we are going through this process. This facility is safe because we do those things. And I think that's an important point that you know, the public needs to keep in mind that
We do have an Ebola committee that we have formed, which meets a smaller committee meets daily in the mornings just to be sure that there has been no changes, no updates that we need to let the staff and administration know. And then we have met the minimum 3 times a week as a department, like department heads, a bigger committee to where we can kind of discuss our plan. We are planning to meet with our first responders and law enforcement so they can see what our plan is and how they would fit into that plan, making sure that we are all working together to protect the community if there is an outbreak. We are also planning on doing a community outreach just to kind of set up some type of forum to, if you know, we have community members that have questions or concerns about our readiness or things that they need to do to protect themselves in the community.
Yeah, and I think we'll as we get our calendar together, the community forum is we have that scheduled a week from Monday, this coming Monday. So that's going to be important. We invite anyone that would like to come to attend that meeting. We are going to try to interact with other county agencies, for like first responders, as you indicated. You know, that will include, we'll extend an invitation to fire. Of course, you know, the hospital runs the EMS and Cypress Transport, but there are other transport companies in the county, so, you know, we'll invite them as well. You know, as Amanda indicated, and CDC is recognizing that, you know, not all patients show up in the emergency room. They could show up just as easily at one of our physician offices, at a physician office. I'll leave it. They could also show up at urgent care. I mean, you know, so everyone in healthcare needs to be aware of these guidelines and have protocols in place to screen.
So we are diligent in training, education, getting people. One of the issues, you know, that came out of Texas was not the type of protective equipment they were using, but the way they put it on and took it off is what they think caused the infection. So it takes two people, a buddy system, to prepare all the protective equipment and to go in and care for the patient. And so we're going to be training on multiple opportunities with the staff to go in and learn that buddy system, how to apply the equipment appropriately and how to disrobe from it appropriately where you don't get contaminated. And that's very important.
That is, our staff here deal with airborne diseases and contact diseases on a daily basis. They are very familiar with putting on PPE. What makes this so different and why we're going to be so vigilant in making sure that they understand that buddy system is because this is a new virus that involves droplet and contact, and we're practicing the airborne and contact. So that is a new process for healthcare everywhere. Practicing two of those.
Another layer of safety.
Exactly right. So we have formed what we're calling a first response team that'll be individuals that are volunteers to actually take care of an Ebola patient should this come to our facility. So they'll be the ones that will be the first responders that are assigned to that patient, as well as a decontamination team that will actually be able to take care of those hot spots, those points of entry whenever they actually come into the facility and register. Because that then again is going to be a hot spot that's going to need to be decontaminated when that patient is actually moved. So we have forming teams to actually go through that training to be sure everybody is comfortable with that buddy system, making sure they have put on that equipment and taken it off. As well as we had already had a competency fair scheduled like we do every year for next week. So we are again making sure that all staff are familiar with the correct PPE we have available, as well as hazmat suits, making sure they have the opportunity to put that on using the buddy system and take it off. But again, the main focus will be on those first responders and then branch out from there.
Well, one thing you also, and Amanda's correct, you know, our staff deals with these types of diseases virtually on a daily basis, you know, risk of exposure. So we know how to decontaminate an area. And so part of the team is environmental services. So I want everybody to feel comfortable that, you know, if we were to get a positive person of interest, you know, we are confident we can contain that. Now, one thing I want you to say, what I want you to understand is, for those 3 instances that we've had, you know, our process went well. Did it go perfect? No, it didn't go perfect.
Already reviewed what happened and see how you can
Yes.
learn.
We definitely
Absolutely.
do that.
So everyone, as we're being cautious in our screening protocols, we learn every time, and we tell you what we learn.
We have revised our algorithms. We've revised our forms. And that is very challenging, staying up to date with these guidelines that are changing almost on a daily basis, as well as these patients come in. Have we looked at every aspect of how we can identify these patients when they come in? Because it is so vague as far as your symptoms.
While I'm recording, talk to me a little bit more about the transmission.
The transmission is through blood and body fluids. That's going to be contaminated blood or body fluid, or a virus has to actually get into your eyes, nose, and mouth, or break in the skin or needle stick. It can also be transmitted on contaminated objects. It can actually live outside of the body at room temperature in blood and body fluids. The guidelines are not giving us specifics, but it says for days. As far as on contaminated objects such as medical equipment or just anything, it can live for several hours. Again, no specifics because I think they just don't know enough about it at this point. And of course, it can be transmitted by bushmeat, and that's where this virus actually started. Was in West Africa. They would eat what they call bushmeat. They don't know the actual reservoir. They think it was actually from a bat. The infected bats, of course, will bite deer, other non-human primates such as apes, monkeys, those kind of things, and then they will in turn eat the infected meat, transmitting the virus to humans.